great to be here. So I'm going to talk to you about the feasibility of using UCAN, which is a needs assessment tool for young adult survivors of the CNS tumour. And so for people coming to our late effect service at Christie Hospital in Manchester, who see people who need lifelong follow-up, who are more than 5 years out of treatment and aged over 16 years. So I don't need to tell anyone here why we need to use a needs assessment tool, but there were no needs assessment tools specifically for this population. So during a PhD, I guess this was the focus of the PhD, and developed and validated the questionnaire. There are other questionnaires that are available for young people, but they're often lengthy. People with cognitive impairment may struggle to concentrate for the length of the existing questionnaires. So young people in our service fall outside of that support from the MDT that they get during treatment, and there's very little non-medical support. So using a needs assessment tool as part of routine practice aims to standardise the approach to the assessment of psychosocial needs, which is advocated by the IGHD. And no standard approach means that multidisciplinary support is inconsistent and ad hoc. Identifying unmet needs is the first step in that process of improving person-centred care and making sure each person has the opportunity to say what matters to them, so we can tailor the support for what their needs are. You can see the draft of the final questionnaire on the screen. So the questionnaire followed 3 stages, international guidance, 3 stages. I could talk for way more than 5 minutes just about that. Items were generated using qualitative data, using quotes from young people. We tried to keep the wording as close to the young person as possible to improve content validity. And the recall period of the questionnaire, so we asked people currently, how do you feel, rather than asking them to consider how have you felt over the last month, which is common to other questionnaires. And then we did cognitive interviewing with 8 young people, so checking, do the questions mean what we want it to mean to them. Some of the questions from that following the cognitive interviews were split. So an example, there was a question about fertility, and young people said they recognise that could mean they have endocrine, it could mean their endocrine function or hormone issues, or it could mean starting a family, and they recognise there are different ways of having a family. So we split some questions. So then after we kind of got that first set of items, we ended up increasing the number, but then using item refinement rationalities, we got it down to the final 16. And it had good test-retest reliability, and there's a paper in Neuro-Oncology Practice that goes into more detail about that development. So using an existing platform at the Christie Hospital, you can share via text message prior to the patient's appointment, and the results, if they fill it in online, results embed into the electronic record, and then they can be discussed in consultation between the young person and the doctor. Following the consultation, young people are invited to complete a short questionnaire asking about their experience, has it changed clinical practice. They're invited to take part in a short telephone interview to get a bit more information. And patients who choose not to complete the questionnaire, we're also asking them for their reasons why, so we can look at improving implementation and overcoming barriers to people who choose not to. And then we're going to speak to the clinicians as well who've been using it and get their perspectives. So we started recruiting in May last year. We've recruited 86 so far, and we want up to reach a target of 100. And the preliminary results today. So the demographics of the population so far that we've recruited, I think, are fairly comparable with the population diagnosed. The response rate isn't bad, but it's much better for the people actually coming to a face-to-face clinic. So we do some telephone video conferencing for the follow-up appointments. and some people will complete the questionnaire when they receive the text message. The majority, if I'm honest, when we approach them in clinic and say, have you completed it? And they'll say yes or no. And then they'll say, well, if you haven't, can you tell us the reasons why? And they're like, oh, well, I'll do it now. So the majority are filling it in when they come to clinic. But we're hoping from the results of this we'll be able to overcome and raise that awareness for when people do receive that text message. So the needs people are telling us about the most are their needs for support.
Is it this one?
Oh no. Turns it off.
So the needs people are telling us about the most need are for support with physical issues. So out of 40, 13 of those strongly agreed to needing support with physical issues. And then the next most common need was needing support to manage their emotional issues. And then the third one was wanting to, help for their family to manage their concerns, which I think is fairly consistent with the current evidence. What was a surprise to me is that belonging to a friendship group and starting a family were some of the lowest scoring needs. And I think when we talk to young people, they feel like some of the most prominent needs that. But I guess this is a snapshot in time for people coming to clinic. So then we looked at the number of people with a different amount of needs, and the scores, as we'd expect, range. It's quite reassuring that a quarter of the population reported they didn't have any need for help for any of the items. But that still means there's a large number of people who have some need. So 4% of the people that we've analysed so far indicated a need for all 16 items. 6% reported a need for 11 to 15, and then quite high numbers have some degree of unmet needs. And yeah, like I say, this is just a snapshot in time, and I think if we want to really understand, really support people, people need to have access to this, not just at clinic, but whenever there's an issue. And we know that needs fluctuate over time. So when we've asked about the feasibility of using the questionnaire, the majority have said they're happy to complete it. They feel more involved in their care. They actually get to discuss things that matter to them. They feel communication's improved, a bit more confident to raise issues with a clinician that they perhaps wouldn't have otherwise thought about doing. So I think we need to keep using it. So we asked 20 young people who chose not to complete the questionnaire what their reasons were. The majority either didn't receive the text or didn't understand. So we sent the patient information sheet before they received the text message, and it's a lengthy questionnaire, as they always are. Not everybody. I'd probably bet money no one read it. So I think when they got the text message, they weren't really that informed about the need for it. So I think they're things to look at when we're looking at implementing it more broadly. And so next steps, we want to develop the support and the capability of what the questionnaire can do. So whether we can improve so when someone fills it in online, it can generate automatic responses, and maybe signposting to some of these other studies that are going on to support that. The range of issues that we know can help young people. I think support needs to be proactive, interactive, with reminders and prompts. And so we're looking at future funding to develop that. We want to use UCAN routinely and improve that self-management. We've held some focus groups and knowledge exchange events to try and generate some more information from young people about how an intervention will work, how, when, to make sure whatever we're doing after, so now we know what the needs are, what can we do about it, that it's all grounded in what the young people want and will use. And then part of that will be better utilisation of the existing supports. We know there is a lot of support already available, but we also know there's a lot of people who aren't accessing it, and whether using the questionnaire as a screening measure, we can try and signpost people to exactly what they need at that moment in time. And then develop the family support. And that's, I guess, another project, how we incorporate the views of the significant others. So there's another part of the study going on which is looking at, if the young person didn't want to fill the questionnaire in, could anyone who knows them well fill it in on their behalf and give us the same answers? And we're getting quite mixed results with that, which I think again is consistent with what we know already. But how do we provide that standard approach to incorporating the views of family, especially when perhaps the young person isn't always aware of the limitations? So we're interviewing parents as well, and significant other, partner, friends, whoever's important to the young person.